Hi, so I'm going to talk to you about the different techniques that we use to reposition a patient in a wheelchair. So it's very common that a patient slides down in a chair, because we deal with many different patients, some of them can help, some of them are not able to help, some of them are frail and you can't put any pressure on their upper extremity. So we have 3 or 4 techniques that I'd like to go over. The first one that I'm going to demonstrate is for a patient with considerations. So that means that you don't want to put any kind of pressure or pull up on their upper extremity, so we're not going to do that. We are going to use the slider sheet because anytime you reduce the friction, you're also causing it's less heavy on the caregiver. So I'm going to get you to lean forward. Tanaz and I are going to tuck the sheet in behind Navru and kind of right underneath her bottom. Okay. And then we're going to have her lean back and sideways so that I can pull it forward. And again, this is just reducing the friction and making it easier for the clinician to slide the patient back. So a couple of different ways that we can approach this. One, if the patient is wearing pants, it's always easier if you grasp the back of the pants and underneath the leg here, and you'll just bring her back that way, and you'll see that technique used most of the time in the hospital and other facilities. So if you can lean forward, Tanaz and I are going to use very good body mechanics, and we're going to grasp the back of Navroop's pants, and we're going to use our legs to do this, and we're going to put our arms underneath her legs here, and on the count of 3, we're going to scoop her back in the chair. 1, 2, 3. And then she slid very easily that way, and now she's sitting nice and square in the chair. Okay, and the other way that we can do this, say the patient doesn't have any pants on, or you're just not able to get into that area. So if you can slouch forward, there we go. So if the patient is sitting in that pelvic tilt, it's not safe, they could slide out, and you want to get them back in the chair. And so to do that, we want to make sure that they don't slide off. Come forward for us, and we're going to grab the back of the slider sheet and underneath her legs. Okay, and on the count of 3, 1, 2, 3, and you just kind of scoop her back up into that chair. There's another way if the patient is able to assist. It's some physical cueing and some verbal cueing. So if she is slide forward and she's able to assist, you may be able to verbally cue her and physically. So come forward for me, and you can help her by assisting her to walk her hips back. Push one hip back at a time, this hip, and then this hip. Good. And she's just scooting her bottom back. You may have to physically help, and the patient may only need some verbal cues to do that. Another technique, if the patient is slid forward in the chair, good, and you really need to get them back. One clinician will be at the knees, kind of bracing that, and I'm going to get her to cross her arms in front of her. You would only do this if the patient doesn't have any issues with the shoulders or any other upper extremities. And you're going to be standing in the back, kind of crouched down a little bit using good body mechanics. And on the count of 3, Tanaz is going to push on her knees, and I'm going to stand to pull her back. 1, 2, 3. So all the person back here is doing is going from a crouched position to a standing position. Good. And then obviously we never leave the slider sheet underneath the patient. And if the patient does have a tendency to slip forward, we're going to always make sure that the seatbelt is engaged. Come towards me. on so that she doesn't fall, move forward. There we go. Okay. So obviously, if lighter seats are not available, we would use the same techniques, but it would be a little bit more friction.